My name is Kennedy, and today I will be discussing important facts about mental illness, why there is a stigma that surrounds it, and how to end the stigma around it. How many of you know someone with a mental illness? According to the National Alliance on Mental Health, or NAMI, about 20% of the population has a mental illness, so 1 out of every 5 people you know has one. Mental illness can range from actual disorders such as depression or anxiety to learning disabilities such as ADHD and ADD to even substance abuse. All of these things affect the brain, especially the mental function, which forms our personality. So understanding the brain is more complicated than understanding any other organ in the body. The heart is comprised of valves, muscle tissue, and arteries that can be easily studied and understood. However, the brain is much more complex. It's a 3-pound tissue with 100 billion neurons that trigger trillions of connections establishing circuits all to form our personality. Because of the entirety of the brain, it can be difficult to understand and can make mental illness a lot harder to treat. A stigma can be best defined as a dishonor or disgrace. Now, being made aware of the definition lets further the understanding of the stigma around mental health. For example, you were supposed to help your boss at work by coming in early, but you don't show up due to a panic attack, so you tell your boss you were sick. If you choose to tell your boss you are sick versus you had a panic attack, you are falling victim to the stigma that surrounds mental health. The top 3 things to know about mental health and the stigma surrounding it is that number 1, there is a huge lack of understanding when it comes to mental health. Not understanding a mental illness can cause unnecessary judgment and for people to believe that there is something fundamentally damaged about them, so they choose not to speak out about it. Mayo Clinic reports to not let the stigma create shame about your mental health. Allowing the stigma to personally affect you can lead to trouble when trying to deal with it in the future. The second thing to know is that people are ashamed to admit they have a mental illness. In an interview with Jennifer Lawrence, she says, "As soon as you have to take medication for your mind, there becomes such a stigma behind it. This just goes to prove that people don't even want to acknowledge the fact that they have a mental illness because of the ridicule that comes with it." The stigma prevents many from asking for help, which brings me to my third point, the word stigma itself. Webster's dictionary best describes it as a mark of disgrace associated with a particular circumstance. Stigmas have been used to describe countless situations that people don't know how to deal with. For example, there is a stigma around the Jews, and even AIDS had a stigma, but something remarkable occurred. The AIDS advocacy group. There was a treatment found to help treat AIDS. The treatment can be the difference in someone living and someone dying. That is how powerful science can be. Treatment can eliminate this stigma. Treatment for mental illness can transform someone's life. Not all patients will respond the same to treatment. For example, borderline personality disorder is the behavior of self-mutilating and engaging in stormy relationships. The disorder drives away family and friends and leaves psychiatrists reluctant to treat. Dr. Jeffrey Lieberman reports that he had a patient named Lori who had borderline personality disorder and did his best to help her, but she dropped out of treatment. This just goes to show that not all treatments work, and once again, not all patients respond the same. So modern mental health care today even has barriers, such as insurance, awareness, and the stigma itself. But what would happen if there was no stigma? If there was no stigma, we could launch a public health initiative against mental illness, which we have done before with environmental disease, infectious disease, and even heart disease. There are 2 simple strategies to begin with. Number 1, first is early identification and intervention. Screenings would be placed at primary care settings like family clinics, schools, and in the workplace. Those who were screened and showed symptoms would be randomly sent to the care facility to be properly helped. The goal is to identify the illness before it comes up and affects their brain, their lives, and risk them becoming harmful to themselves or others. The second strategy is an approach to providing community-based care for people who are already advanced in their illness or disability. It would include medical management, rehabilitation services, and residential facilities to support people who cannot care for themselves. We have the means to do this, which would change many people's lives. So the question is, how much will this cost? Or can we even afford it? The answer is yes. Health economists have found that providing this mental health care would greatly reduce the cost of delivering health care and result in enormous savings. Families would be relieved from financial burdens. Social problems would be reduced or eliminated. So the best way to end the stigma is to recognize mental illness It can be treated just like a physical pain. Show concern. Don't be afraid to ask. You can get someone help. Also, raise awareness to the government to form advocate groups. Showing compassion is one of the most important things to show someone with a mental illness. So while science and medicine continue to pursue causes of mental illness, I ask that you reach out and to raise awareness and to end the stigma behind mental illness. Thank you for listening. End it.